Well, Peter Mathews is a professor of political science at Cyprus College and the author of Dollar Democracy, with Liberty and Justice for Some, How to Reclaim the American Dream for All. He joins us now from Los Angeles. Thanks very much for being with us. So, California is seen as very much a liberal state in the U.S., but it is something of a pioneer state when it comes to laws like this. What sort of a precedent could this set?
It could set an example for other states like New York, the larger states, the more affluent states, to pursue this path as well. But it's actually a reflection of Governor Gavin Newsom's attempt to get a single-payer system ultimately in California. He campaigned on it. He actually said at the beginning when he took office he'd like to implement that. And it's the beginning of getting part of the segment of the population to be covered, even the undocumented folks to some extent. And
just to remind ourselves, Gavin Wilson is the California governor. Is this now at the federal level? Could this be challenged given President Trump's policy when it comes to illegal immigrants?
Yes, it could be on two fronts. One, of course, is you're offering it to undocumented workers or illegal immigrants, as they call them, and that's something Trump doesn't want to do. He doesn't want them to be here. And secondly, is he actually got rid of the individual mandate at the federal Obamacare level, which used to force people to buy insurance or get fined. And instead, this will do the opposite. It will actually bring back the individual mandate at the state level to force Californians who don't have insurance to pay a fine. And that money, part of it could be used to help cover these undocumented folks, to bring them into Medicaid, the statewide public insurance system that's partly federally funded as well. So on two areas, it's conflicting with the federal government. Absolutely correct. This might end up in the courts and get settled finally in the Supreme Court, one way or the other.
And where do you think things will end, given that the Supreme Court tends to lean to the right at this point?
I think the Supreme Court, the two justices that are the conservative ones that he appointed, that Trump appointed, the Gorsuch and Kavanaugh, these justices have not been proven yet on the economic level, economic decisions such as this. They might actually go along with allowing California this particular right or freedom to do this, because they also believe in decentralized government. So it's possible that this could go through and be upheld by the courts. It's just only one segment, though. It's only, you're talking about 90,000 people, $98 million. That still leaves millions of Californians uncovered, both who are born here legally and working here, as well as undocumented American Californians who are here, who are not covered with health care. And this is very dangerous, because when people work in public sector jobs, like in restaurants or other places, they must be ensured that they are covered health-wise so they can go take care of any potential disease or infection they could have that can get passed on the rest of the population. So it's just a practical question, also a philosophical one, which goes to the point that healthcare is a human right that should be guaranteed for all. Right. And that's something that most modern civilized countries have.
Peter Mathews, thanks very much for being with us. We're going to go back to Hong Kong now. Hong Kong Chief Executive Carrie Lam holding a news conference